This slide shows you the body's major arteries. The aorta is the largest artery of the human body, and the arteries are responsible for carrying oxygenated blood to the tissues and organs. Healthy arteries dilate and contract to accommodate the metabolic needs of the body. Some tissues of the body, such as the liver and spleen, have a very rich supply of capillary networks, which can cause them to bleed easily and often profusely when injured. And a fun fact, your brain makes up only 3% of your entire body's tissues, but it requires 20% of the oxygen it takes in. That means there are some really, really big arteries leading to and within the brain. More on that in neuro. Surprise! This slide's about the veins. What? You weren't surprised? Ugh. It's ridiculous. Veins are unlike arteries in that they carry deoxygenated blood. But you already knew that. The next thing you need to learn about the veins is that they contain one-way valves. This is going to be a key in bypass surgery. The purpose of these valves is to prevent blood from backing up. Once the blood moves up along the body on its way back to the right atrium, it will pass through a valve, which acts like a gate so that it can't pool down where gravity wants it to. This physiological wonder is why it feels so good to stretch your legs after they've been stationary for a long time, because it allows blood that's been fighting gravity for however long a slip and slide ride back to the starting gate. That's another reason why stationary jobs are considered a silent killer. So aren't you glad you've selected a career that isn't going to silently kill you? Great. Quick review. What's the biggest artery? What's the biggest vein? What's the smallest artery? What's the smallest vein? Remember 2 slides ago when we talked about arteries becoming arterioles, becoming capillary beds, becoming venules, becoming veins? Well, you can see on this very slide how those arterioles branch off the artery in various places. See the arrows? That's a single arteriole branching off one of the thousands of arteries in your body, okay? Now, see the circles? The circles are there to show you how a metarteriole branches from the arteriole and becomes a capillary bed. Notice how the left image is showing the capillaries at rest when they are filled with the oxygenated blood within body tissue, and the image on the right is when they're contracted and are not being filled, but are instead pushing straight through the venule. This is the body's way of determining which tissues need perfused at any given time. And so sometimes the capillary bed's sphincters say, yes, we would like more oxygen, please. And sometimes they say, no thanks, we're good. If you were to look at these structures under a microscope, you would be able to determine whether you were looking at an arteriole or a capillary based on how thick it is, because capillaries are only 1 cell thick. And that's important because then oxygen, among other substances, can be exchanged. On this slide, we're going to take a close look at the structure of the vessels. Just like Shrek the Ogre, vessels have layers, and we're going to learn about them. Haha! So, there are 3 distinct layers: the tunica adventitia, the tunica media, and the tunica intima. An easy way to remember them is to remember the middle layer is the media, the intima layer is the innermost layer, and that just leaves you with adventitia, the only layer left, which has to be on the outside. So by process of elimination, you've got your 3 layers. The adventitia is the wall of the vessel. It's what you'll see when you make an incision and are looking directly at it. Directly beneath that is the media, which is the smooth muscle of the vessel. This layer is the one that is affected by our vasodilating and vasoconstricting medications. The intima layer is composed of endothelium, which is also the exact same type of tissue that composes the capillary structures. This slide breaks down the tasks performed by arteries and veins in addition to what's on the slide. Note that arteries have a thicker muscle layer and more elastic fibers than veins do. Veins, therefore, are usually more fragile, and because the blood pressure in them is lower than the artery's blood pressure, a bleeding vein can actually be really difficult to control. Speaking of blood pressure, what is blood pressure? Do you remember? Blood pressure is the pressure exerted on the arterial walls by the pumping action of the heart. Write that down. As you can see, there are many factors that affect blood pressure. Blood pressure is typically higher in women and tends to increase with age. It is typically higher in people with a higher BMI, and it's typically lower in people who exercise regularly. Remember the analogy from earlier regarding running? When the body is required to respond to different circumstances such as rest and exercise, that requires the structures involved to stay healthy and functional, therefore less likely to become sclerotic and dysfunctional. Diurnal fluctuation can be used to describe many things, including blood pressure, in that it fluctuates throughout a period of time. For blood pressure specifically, it is at its lowest point after one has fallen asleep and continues as such until they wake. Then, it commonly rises throughout the course of the person's wake time until it gradually begins to decline as they fatigue. It is also influenced by body position, temperature, pain, and emotion. Good golly, are we complex or what? Lastly, we need to talk about what the heart is actually doing in order for us to measure someone's blood pressure. Blood pressure is documented as the systolic pressure over the diastolic pressure. During the systolic phase, blood pressure is determined by the amount of force exerted on the arteries. This occurs immediately after the ventricles contract. You remember from earlier how the right ventricle and the left ventricle will contract at the same time, but the right chamber sends deoxygenated blood to the lungs. The left chamber sends oxygenated blood to the aorta. Got it? So the ventricles contract. They exert force on the arteries. Meanwhile, the atria are relaxed and are filling. The right atrium is filling with deoxygenated blood from the vena cava, and the left atrium is filling with oxygenated blood from the pulmonary vein, which is attached to the lungs. The atria fill, the ventricles contract, ba-boom, heartbeat, systole. Got it? Immediately after the ventricles contract, they want more blood. So the atria have to contract while the ventricles relax and fill. It's during this time that diastole occurs, at which time no force is being exerted on the arterial walls. Okay, so we just finished talking about what's supposed to happen. But guess what? We don't get the supposed to's in the OR, do we? When a person has consistent high blood pressure, they're deemed hypertensive. That could be a result of a number of factors, as seen on this slide. The hypertensive patient may not have elasticity in their arterial walls. They may have a higher blood volume than normal. Psst! It's average that people should have about 77 mLs of blood per kilogram of weight. Can you figure out how much blood is coursing through your vessels? Additional causes of hypertension include peripheral vascular resistance, which occurs when the muscular layer is unable to relax or arteries are stiff and the diameter is reduced, thus increasing pressure, and possibly even blood viscosity, which is the thickness or stickiness of blood and how it travels through the arteries. All of these factors can contribute to hypertension, but know that hypotension is also a possible condition in our patients, and that can be caused by low blood volume, infection, or shock.